Hi, my name is Andrew Phillips. I'm the founder and editor-in-chief of Coach, coming here with another installment for EP Monthly. So this question, it's one of those, I think it's a good lesson, not only for the educational purposes of medicine, but also for test taking, because you may look at this right off the bat and see that the patient is pregnant, and then look and see that the patient had seizures, and maybe jump on the magnesium and think, oh, it's eclampsia, and try to flip through the question very quickly. However, take careful note of the gestational age of the pregnant patient, of the fetus. Now, technically, and I want to point this out, eclampsia can happen at any time in the pregnancy, technically speaking. It is quite rare, exceedingly rare, before 20 weeks gestational age, but it is technically possible. Preeclampsia is also possible before 20 weeks, but it would be an atypical feature. So, bear in mind that 20 weeks is an important marker, and the probability of being eclampsia or preeclampsia, if there's no seizure involved yet, is much higher after the 20, and fairly, very, very rare for eclampsia, and quite uncommon to rare for preeclampsia. But that's not what this question is asking. So if you get to the end and you realize, wait a minute, things really aren't quite lining up, take a step back. You'll notice that the only one of the answer choices there is magnesium in terms of any kind of eclampsia or preeclampsia treatment. Is just magnesium. You don't see any labetalol or anything like that to worry about the blood pressure. What you do see are several other medications for, and read it if you haven't already, because spoiler alert, right? Hyperthyroidism. So the issue here is that the patient, once she was pregnant, stressed her body enough to jump into hyperthyroidism. And one of the things that's going to flag this, or should flag this for you, is that she's febrile. Typically, you're not going to see a patient be febrile from eclampsia. That's not part of the typical regulation system. That's messed up, right? When you have somebody with eclampsia. So we look at the EKG, we have AFib RVR, we have a fever, we have someone who had some nausea and vomiting, was jittery for the last several days, and you put it all together, and now you have a hyperthyroid storm. The issue, though, too, the other tricky thing about this is now you have, well, how am I going to block my action of the thyroid with thyroid hormone? And you need to get some sort of medication, one of the thiamides. Now, the issue is that normally methimazole is the go-to drug, but in pregnancy, because methimazole has the potential for, because it's a teratogenic medication, you got to go with propylthiouracil. So think of methimazole as the most common one. That's usually going to be your answer. However, in pregnancy P, propylthiouracil is the way to go when you have a hyperthyroid storm. This is Andrew Phillips from Coach. Thank you for watching.